Hello and welcome. My name is Catherine Idowu. I'm a family nurse practitioner and a Doctor of Nursing Practice candidate in Wagner College. I will be presenting on improving discharge planners' education on telehealth, an effective approach for discharge planning of the elderly population in Nigeria. The program aimed to provide a structured approach to improving discharge planners' education on telehealth through the development, implementation, and evaluation of telehealth educational program for hospital discharge planners and ensuring the effective discharge planning of the elderly population in Nigeria. The project encompassed the assessment, development, implementation, and evaluation phase of the educational program. At the end of the program, we should be able to define the use of telehealth within the healthcare system of Nigeria, explain the key benefits of making telehealth referrals for post-discharge follow-up care, identify patient criteria for determining which elderly patients are appropriate for a telehealth referral, describe the key elements for patient education on telehealth process and procedure, understand the steps in navigating telehealth for a patient, learn protocols for coordinating care, sharing information and addressing barriers with telehealth providers throughout the post-discharge period. The elderly population in Nigeria, defined as those aged 60 years and above, is a vulnerable group with unique health and wellness needs. Nigerian life expectancy continues to rise, coupled with the number of elderlies projected to reach over 12 million by 2030. This is according to National Population Commission of Nigeria. However, access to health care is limited. Reducing the rate of acute care hospitalization and the wellness of this group becomes crucial. Elderly patients discharged from hospitals in Nigeria are at high risk for adverse events and readmissions due to inadequate transition of care planning and follow-up, especially those with chronic conditions like hypertension and diabetes. Implementation of telehealth has been slow to be adopted and difficult to sustain. According to World Health Organization, information and communication technologies have great potentials to address some of the challenges faced by both developed and developing countries in providing accessible, cost-effective, high-quality healthcare services. Telemedicine uses information and communication technologies to overcome geographical and infrastructural barriers that will increase access to healthcare services. This is particularly beneficial for rural and underserved communities in developing countries, groups that traditionally suffer from lack of access to healthcare. According to Centers for Disease Control and Prevention, telehealth can be an effective approach for communication and counseling. It is also a good way for doctors to monitor their patients' chronic conditions, like heart or lung disease. Better monitoring can improve patients' quality of life and reduce hospital admissions and deaths from chronic diseases. In addition, telehealth is a good way to deliver care quickly in an emergency, such as stroke. Educating and equipping discharge planners to incorporate telehealth referrals into discharge planning for elderly Nigerians could make an immense difference in avoiding negative outcomes and improving transitional care for elderly patients. This educational program underscores the pressing need to equip discharge planners with the necessary knowledge and skills to facilitate telehealth referrals for Nigerians' elderly population. Ultimately, this will assist providers and patients in bridging the gap to access healthcare services, improve health outcomes, and significantly enhance the overall wellness of the vulnerable elderly demographics in Nigeria. According to American Heart Association, telehealth is the delivery of healthcare services at a distance using information and communication technology. Implementation of telehealth has been slow to be adopted and difficult to sustain. Researchers developing theories concerning the introduction of complex change in healthcare usually take a multifactorial approach. Telehealth has emerged as a valuable tool in healthcare delivery, offering opportunities for improved access to care, especially for vulnerable populations such as the elderly. As part of discharge planning for elderly patients, the integration of telehealth referrals can enhance post-discharge monitoring, which reduces readmission rates and promotes continuity of care. The benefits of telehealth referrals include improved access to follow-up care, early intervention for post-discharge complications, enhanced medication adherence and self-management, increased patient engagement and satisfaction. Regarding the criteria for telehealth referrals, we have 5 different points. The medical condition and stability entails elderly patients with stable medical conditions that do not require immediate inpatient assessment or intervention, and those with chronic conditions or diseases, example hypertension and diabetes. Medication management and routine follow-up care will be considered suitable for the telehealth referral. Mobility and transportation issues concerning the elderly patient with limited mobility or transportation barriers who have difficulty accessing transportation or experience challenges with mobility due to health or age-related issues will benefit from telehealth services as it eliminates the need for travel to healthcare facilities. For technological literacy and access, elderly patients who demonstrate basic technological literacy and have access to necessary devices, example mobile phone and WhatsApp, are suitable candidates for telehealth referral. Elderly patients residing in rural or remote areas with limited access to healthcare facilities will benefit from telehealth services as it allows them to receive care from distance. Telehealth is to bridge the gap in healthcare access for elderly patients living in underserved or isolated communities. The final points for the criteria will be communication and cognitive abilities. Elderly patients who have adequate communication skills and cognitive abilities to participate in telehealth appointments effectively will be suitable candidates because they should be able to understand and follow instructions, express their concerns or symptoms, and engage in meaningful dialogue with healthcare providers during telehealth visits. The elements for telehealth entails identifying the use of effective technology for telehealth virtually using mobile phones with WhatsApp, understanding the process for navigating telehealth for underserved elderly population in Nigeria, providing access to healthcare practitioners, and creating a proper discharge plan through telehealth for elderly patients, assigning discharge nurses to provide a step-by-step guidance to elderly patients in Nigeria, access to support services and information after discharge from hospital, example on-call discharge nurse and medical practitioner specialty lists. Telehealth process and procedure, including steps to ensure effective delivery of remote healthcare services, include these steps. During discharge planning for the elderly patient, discharge planning nurse will collect information needed for the telehealth process, including consent. Upon discharging patient from hospital, the discharge nurse will give patient proper paperwork with discharge summary and instructions, providing step-by-step guidance on scheduling appointments, pre-appointment preparation, and post-appointment follow-ups. Patient will be given detailed care plan instructions like wound care or medication regimen. The nurse will follow up with a video call through WhatsApp 1 to 3 days after discharge to further explain or help with navigating instructions. There might be challenges for patients due to age, language, and cultural understanding. Depending on the outcome of the follow-up call, patient will either continue with care plan, Receive another video call through WhatsApp in a week or as needed. Follow up with healthcare practitioner or a specialist if needed for any specific issue, be it endocrinologist, cardiologist, or return to hospital at a given time. It could be 6 weeks or as needed. Discharge nurse will help elderly patients schedule appointments. Patient will follow up with primary care doctor after discharge, using the same discharge nurse to schedule these appointments too. Patient will have reminders prior to appointments through WhatsApp to ensure patient meets all appointment schedules. Process will terminate or continue as needed, depending on the health outcome and needs of the patients. Care coordination with telehealth providers is another important aspect of this program. So information sharing protocols entails securely transmit referral details like notes, test results to telehealth team. Receive updates, reports, and data back from virtual visits, monitoring, and so on. Maintain open communication channels for seamless coordination. Integrating telehealth data is another care coordination point here. Incorporating telehealth insights into overall care plan for the patient, reconcile any changes recommended by telehealth providers, leverage telehealth data for proactive intervention as needed. Addressing barriers and ensuring follow-through will be the final point in this aspect of care coordination. Identify and resolve technology, adherence, or other issues. Facilitate warm handoffs and connections to additional support services. Provide feedback to telehealth team to optimize virtual care delivery. As Nigeria continues to grapple with an aging population, a holistic approach to wellness will be essential to ensure the elderly population's well-being and societal contribution. The wellness of the elderly population in Nigeria is a multifaceted issue encompassing physical, mental, social, and economic dimensions. Targeted interventions and valuable insights into the challenges and opportunities for enhancing and optimized transition of care underscores the importance of policies that address the specific needs of this growing demographic group. These findings highlight crucial areas for policy, healthcare accessibility, and communication intervention to promote wellness and healthy aging among the growing elderly population in Nigeria. In conclusion, empowering discharge planners through educational program on telehealth is a total package that encompasses the multidisciplinary team who understands the multifaceted nature of their roles in adopting the improvements of transition of care. In this case, focus is on implementation of telehealth referral utilization in discharge planning. This program will assist the transformative changes occurring in healthcare, the ideal education, skills, and licensure that puts them in the right position to positively impact the management of elderly patients being discharged from hospital to home. To summarize the key facts of what we have learned today, I'm going to go back through these points. Telehealth is the use of electronic information and telecommunication technologies for remote healthcare delivery. We also said the main purpose of making a telehealth referral for an elderly patient is to provide continuity of care and follow-up after discharge. The major benefit of telehealth referrals post-discharge is early identification of complication or issues. The healthcare provider and discharge planning nurse's contact information are the key information that should be included in an effective telehealth referral. The key advantage of making telehealth referrals for elderly patients is reducing hospital readmission and eliminating the need for in-person follow-up. And effective care coordination between discharge planners and telehealth providers involves sharing updates and integrated care planning. When making a telehealth referral, discharge planners should prioritize referring patients to providers best suited for the patient's needs. Upon discharge from the hospital, a follow-up call from the discharge planning nurse should be made on the third day post-discharge. An essential element of education on telehealth process and procedure is providing a step-by-step guidance on scheduling appointments. New onset of diabetes is one of the medical conditions that is a priority for a telehealth referral. I want to thank you all for participating in this program, and I believe at this point we are able to define the use of telehealth within the healthcare system of Nigeria. We will be able to explain the key benefits of making telehealth referrals for post-discharge follow-up care. We are able to identify patient criteria for determining which elderly patients are appropriate for a telehealth referral, and we're able to describe the key elements for patient education on telehealth process and procedure. We can understand the steps in navigating telehealth for a patient, and we have learned the protocols for coordinating care, sharing information, and addressing barriers with telehealth providers throughout the post-discharge period. For resources that will be provided for our telehealth participants, they will need a list of healthcare providers, the list of healthcare specialists that they need, the list of healthcare labs that they will need for their blood work, and the list of pharmacies for medication refills. Again, I want to say thank you for participating in this educational program. I believe you all have benefited from this, and I appreciate each and every one of you. Thank you.